This is case scenario 6. A 53-year-old is admitted to the MICU COVID-19 positive with a pulse ox of 82% on 8 liters of oxygen. Proper PPE needed to enter COVID-19 rooms include a gown, 2 pairs of gloves, face shield, N95, a surgical mask over the N95, and the door must remain closed and no visitors are permitted. Coronavirus in general is a common virus that causes an infection in the nose, sinuses, and upper throat. COVID-19 is otherwise known as SARS-CoV-2, which is a form of coronavirus that originated in December 2019 in China. COVID-19 triggers an upper and lower respiratory tract infection and affects the sinuses, nose, throat, windpipe, and lungs. Symptoms of COVID-19 include fever, cough, shortness of breath, difficulty breathing, fatigue, chills, body aches, headache, loss of smell or taste, sore throat, congestion or runny nose, nausea, diarrhea. COVID-19 risk factors include chronic kidney disease, COPD, a weakened immune system, obesity, serious heart conditions, heart failure or coronary artery disease, sickle cell, and type 2 diabetes. Patients diagnosed with COVID-19 are often placed on continuous pulse ox and telemetry so that the nurses are able to monitor the status of the patients while sitting at the nurse's station. Recent CDC guidelines include wear a mask. Everyone 2 years and older should wear a mask in public. Social distance by staying at least 6 feet apart. Avoid crowds in poorly ventilated spaces. Wash your hands often with soap and water for at least 20 seconds. If soap is not available, use hand sanitizer that contains at least 60% alcohol. Cover coughs and sneezes. Clean and disinfect frequently touched surfaces daily, and monitor your health daily. Here are the recent CDC guidelines on vaccines. Recently, vaccines are being administered to people across the United States. The CDC recommends vaccinations to people who are able to get it. Additionally, they recommend getting vaccinated even if you've had COVID-19 in the past. As of March 15, 2021, here are the stats on cases and data in the last 30 days. Total deaths are 532,355. Total cases are 29,269,590. Total vaccines administered are 109,081,860.
Hi Kat, I'm Laura. I'm going to be your nurse today. I'll be taking care of you all day today. How are you feeling?
I can't breathe.
Okay. Are you having shortness of breath?
Yes,
Any chest pain?
kind of.
Okay, I'm going to take a quick listen to you here. Okay, can you sit up for me? And take a deep breath. Okay. I see that you're a little short of breath and your heart rate is up. Your oxygen levels are a little bit lower at 77%. Can you tell me where you are today?
I don't know.
Okay, can you tell me your name?
My name's Kat.
Okay, and can you tell me who the president is?
Joe Biden.
Okay, good. Can you squeeze my hand for me? How about this one? Good. I'm going to take this down for a second. Can you wiggle your feet for me? Okay, good. Now listen to your stomach here. You can lay back down. Any pain when I touch?
No. Can I have my blanket back? I'm cold.
Sure. Let's see here. Okay, looks like you have a little bit of a temperature. 102. We're going to pack you with some ice to bring that down a little bit, okay? And I'm also going to sit you up in bed here. And I'm going to increase your oxygen to 15 liters because you're short of breath. Okay? And then I'm also going to work on some deep breathing exercises with you so that you can open up your lungs and expand your lungs, okay? I'm just going to pop these in here so that we can lower your temperature, okay? Okay. We have this incentive spirometer for you to work with here. And I just want you to take, before you do it, you can just work on some deep breaths. Go in through your nose and then out through your mouth. Good. And just do that for a couple minutes.
I can't breathe.
Okay, just work on taking some deep breaths. Your oxygen's at 15%. Okay. Okay, your oxygen has come up to 87%, which is good. Okay?
Okay.
Good job. Okay.
The pulse ox was 78%, the heart rate was 122, blood pressure was 138/90, the respiratory rate was 28, and the temperature was 102.4. The patient is diaphoretic, short of breath, use of accessory muscles, cyanosis on fingers and toes, alert and oriented ×2, and patient does not know where she is. The nurse stayed with the patient for 5 minutes. SpO2 increased to 84%. The nurse left the room to consult respiratory and update the healthcare provider.
Hi, respiratory. This is Mara from Medical Intensive. I'm taking care of a patient in 3805, and her oxygen, she came in at 82% on 8 liters of oxygen. I just went in to assess her, and her pulse ox was 78%. So I bumped her up to 15 liters. I sat her up and worked on some deep breathing exercises with her, but she was really short of breath. She was a little disoriented. She didn't know where she was. She was diaphoretic and using accessory muscles, and she had a little cyanosis on her fingers. So I worked around that. I packed her with some ice because she also had a temperature, but I didn't know if you wanted to come down and look at her since she was really short of breath, and I don't know how long she'll last on the 15 liters.
Okay, I'll be right down.
Okay, thanks.
Bye.
Bye. Hi, Dr. H. This is Mara, the nurse taking care of a patient, Kat, in 3805. I just wanted to give you a little update. She came in with 82% on 8 liters of oxygen. I just bumped her up to 15 liters, and she was sitting around 85%. She is diaphoretic, short of breath. She has little cyanosis in her fingers, and she was agitated and restless. I sent respiratory in, and he's going to work with her a little bit, but I just wanted to give you an update.
Okay, thanks for letting me know.
You're welcome.
The physician decided on ordering remdesivir, an antiviral, dexamethasone, a corticosteroid, which helps decrease inflammation in the lungs, enoxaparin, a low molecular weight heparin to decrease the risk of pulmonary embolism and deep vein thrombosis. Findings are showing high risk of clots in COVID-19 patients, a stat chest x-ray, and due to medication side effects, the physician ordered a renal and hepatic lab panel and an APTT. The IDSA guidelines recommended use of remdesivir among hospitalized patients with severe COVID-19. Severe COVID-19 is defined as patients with an SpO2 of less than 94 on room air, or patients who require supplemental oxygen, mechanical ventilation, or extracorporeal mechanical oxygenation. The pulse ox is 80% on 15 liters of oxygen. Patient continues to complain of the same symptoms. Breathing is extremely labored and some retractions are noted.
Hi, ma'am. How are you today?
I can't breathe.
Okay, well, my name's Robbie. I'm a respiratory therapist. I'm going to try to help you with that, okay?
Okay.
So we're going to go ahead and I'm going to listen to your lung sound. We'll sit you up. We'll listen to the backside and see what we think. I can pull these off my face a little bit. They're steaming up. Let's take deep breaths for me, okay? Now, does it hurt to breathe or no?
I just can't breathe.
Okay. Do you think you'd be okay to sit up for a second?
I can try.
Okay, let me help you. Just like that. Good job. I'll fix that ice when we're done. Just breathe normally, please. Yikes. Okay, you can go ahead and lay back down. Okay, we're going to go ahead and put you on your belly in the prone position, okay? It's going to help open up those other lung fields that otherwise really wouldn't open up, and it's going to stop issues you're going to have from laying on your back. Alrighty? You want to go ahead and roll over for me? Make sure your lines don't get tangled. You're moving well, that's good, right?
I can't breathe on my stomach.
Let's give it a moment, okay? We're going to wait like 5 to 10 minutes and see how it works. Okay?
Okay.
I'll be right beside you watching.
A little longer than a few minutes later.
All right, it's been 10 minutes. How you feeling?
I don't like this. I can't breathe.
Are you sure?
I'm sure.
Well, go ahead and turn back over, okay? Just make sure your lines don't get caught.
When is this going to get better?
I'm going to check your SpO2 right now, and then we're going to go ahead and we'll go from there, okay?
Okay.
You're looking a little pale and cyanotic.
Yeah, I'm cold.
Still trouble breathing?
Yes.
Okay. Well, let's go ahead and check your SpO2. It's on. We'll go ahead and look at the reading. 82. It's not getting any better. I'm going to go ahead and put on a non-rebreather mask,
Is that
okay?
going to fix it?
It's going to give you the highest amount of oxygen concentration we can. So hopefully it does. We'll see how it resolves it, okay?
Okay.
That's it done. If it's uncomfortable, let me know. We'll try to fit it to your face a little
It's
better, okay?
uncomfortable.
Touch that to your nose. How does that feel?
I can't breathe.
Just take some deep breaths, okay?
You're going to make me hyperventilate.
Easy. Slow on the way out. Slow on the way in.
Now I'm scared. Am I going to die?
You're not going to die. It's going to be fine. You're going to be fine. Okay, your SpO2 came up to 88, so that's good. So, did the nurse go over this with you earlier or no?
Uh-huh.
Do you still remember how to use it?
Huh?
Alrighty. Well, you're going to take a deep breath in, blow it out, and then
How am I
breathe back
supposed to
in
use that if I
slowly.
have this on?
Well, I'm just teaching you to be safe. It's okay. I understand you're worried, but we're here for you, okay? We're doing everything we can. Do you have any questions, any fears?
Am I going to get better?
Hopefully that's the plan,
Can I
right?
have my family here?
Yeah, we're going to talk about that later, okay? We're going to talk to the
Well, I
doctor
need somebody
first.
here. I'm scared.
I'm here for you.
What
It's
if I
okay.
die and I'm alone?
You're not going to. Just
You
deep
can't promise
breaths.
that. You don't know.
Deep breaths.
This is making it worse.
Deep breaths.
I'm so cold.
We can get you a warm blanket. Is that okay?
Uh-huh.
Okay, well, I'm going to stay with you. We'll ask a nurse to get you a warm blanket.
Okay.
Okay.
Is my fever getting better?
We don't have a temperature, but I'll grab it real quick, okay?
The respiratory therapist left the room, and the physician will come into the room to explain the results of the x-ray. As compared to regular pneumonia, COVID-19 pneumonia has peripheral ground glass opacities and consolidation that affects the lower lobes with COVID. An example is pictured to the right.
Hi, Kat. I'm Dr. H. How you feeling today?
I just can't breathe.
Well, I'm just here to inform you that your chest X-ray came back positive that you were positive for COVID pneumonia.
Am I gonna die?
You're not gonna die. It's gonna be okay. We have medications that help you with your symptoms, and I'm gonna start you on azithromycin.
Can my family come in and visit me?
Unfortunately,
I don't want to die alone.
Unfortunately, due to the COVID pandemic, we're not allowed to have visitors in the hospital, but you can absolutely FaceTime them or call them anytime.
So what if I die alone in here without my family here?
We're gonna be here with you. Everything will be okay.
Can I talk to them?
You can FaceTime them. We can set up a FaceTime with them later.
Okay, can you help me?
Sure.
Hi, this is Kali, Kat's daughter. Are you the nurse taking care of her?
Yes, I'm the nurse taking care of that today.
I mean, how is she doing? I'm just so worried.
I know, we're taking really good care of her. She's doing okay. I just had the respiratory therapist in there. He was working with her, and he proned her, which is when you lay on your stomach. And that's supposed to help oxygenate her whole entire lungs and help perfuse her lungs better and get her breathing better. We just put her on a non-rebreather mask, which is supposed to give her the highest level of oxygen possible. Her chest x-ray did come back positive for COVID pneumonia, so we're gonna start her on some antibiotics and some medication and help her get through it, okay?
Okay, well, can I see her? I'm just so worried. I know she's so afraid.
I know, we're with her the whole time, but unfortunately due to the COVID restrictions, you can't see her.
Well, is there any way I can, talk to her?
We can set up a Zoom call with you and your family members later if you'd like.
Yes, I would definitely like that. I know she's just so afraid.
Yeah, we're with her the whole time. I know it's scary, but we're gonna take good care of her, and we'll set that up for you, okay?
Okay, thank you.
You're welcome. Hi, Kat, how are you feeling?
I'm just kind of struggling to breathe.
Okay, well, we're gonna give you some medications. I have 4 medications that the doctor ordered for you, okay?
Okay.
So the first one is gonna be a steroid. It's called dexamethasone. It's gonna help decrease the inflammation and open up your airway, okay?
Okay.
And then the second one I'm going to give you is enoxaparin. It's an anticoagulant. It's just a little shot in your stomach. It's going to help prevent blood clots because COVID predisposes you to some blood clots and you're kind of bedridden right now, so it's going to help with that, okay?
Okay.
And then the third one is going to be azithromycin, which is an antibiotic to help with the COVID pneumonia. And then the last one is remdesivir, which is what we give to our COVID patients who are having a hard time getting their oxygen levels up, okay?
Okay.
Can you state your name and date of birth for me?
My name's Kat Keller, and I was born July 30th, 1967.
Okay, good. Okay. Okay. I have some medications here for you. 2 of them are going to go in through your IV port here. Okay, last one. Okay. And then this one I'm also going to hang, it's going to connect to your IV, okay?
Okay.
So this is just going to infuse over an hour or so, okay? If you have any trouble with it, let me know.
Didn't you say you're giving me a shot?
Yes, I have one more shot to give you, okay? All right, so it's just going to go in your stomach right here. And it's just going to be a little pinch.
Okay.
Okay, all done.
Okay.
Good job. Of the medication with you, okay?
Okay.
Okay, so the dexamethasone, you can have some increase in your blood sugar, so we will be checking your blood sugar.
Okay.
It can make you feel a little irritable or kind of angry. It's just what a steroid does to you. It can also have some nausea, vomiting with it. And then the noxaparin, it puts you at risk for bleeding. So if you notice any bleeding internally, or any bruising or bleeding outside of your body, let us know, and it can decrease your platelets a little bit, so we'll be careful that way, okay?
Okay.
The remdesivir can cause some nausea, vomiting, constipation, bleeding, or body aches. And then the antibiotic, the azithromycin, can cause some heart palpitations, loss of appetite, bleeding, or nausea or vomiting as well. Okay? I'm going to take a look at your oxygen here. Let me read it here. Sometimes it can have a hard time reading if your fingers are cold.
Okay.
Okay, 85%.
Okay, I still can't breathe.
Okay, yeah, so it's still down a little bit. I'm going to send in and call the respiratory therapist, okay?
Okay.
You're doing good, okay? Hang in
Okay.
there.
The new physician orders. The nurse calls the physician because the pulse ox is not improving substantially and is still below 90% on a non-rebreather. The physician puts in an order for BiPAP.
Hi, Kat. Do you remember me?
Yeah.
Okay. Well, the non-rebreather doesn't seem to be working, so we're going to go ahead and we're going to put on a BiPAP,
So I'm
okay?
not breathing?
You're breathing. It's just not, you're not getting enough oxygen in and retaining it.
Okay.
The BiPAP's going to help you with pressure on the way in. It's going to open up the lungs. And then when you breathe out, it's also going to keep that pressure there to make sure they stay open, okay?
I don't know if I'm gonna like that.
I'm not sure either. We're going to try, okay?
Okay.
So this is our BiPAP.
Are you gonna have to put a tube in my throat?
No, we shouldn't.
Am I gonna die?
No, you'll be fine. Alrighty. So we're going to go ahead and look at this. Oh, your SpO2 came up to 94. You feel like you're breathing easier?
No? I don't like this.
Well, let's go ahead and leave it on, okay? Give me your hand. We'll be fine. Deep breaths, okay?
I need my family. I'm gonna die.
We're going to get that Zoom call going for you real quick, okay? Do you remember your nurse that was in here giving you meds?
Uh-huh.
She's going to come back in. We're going to set up that Zoom call, okay?
Okay.
Is there anything I can do for you right now?
Get this off of me.
We can't. We got to leave it on just for now, okay?
Okay.
When you get better, it'll come off.
Okay.
How you feeling?
Anxious?
You breathing a little easier?
Kind of. I don't know if I like this though.
You want to take deep breaths with me? In and out? I'll do them with you, okay?
Okay.
Deep breath in. Exhale out. Deep breath in. And exhale. All right, I'm going to grab your nurse for you, and you can do that Zoom call, okay?
Okay.
Stay upbeat. You're doing good.
Okay.
The BiPAP settings include an IPAP of 12, an EPAP at 8, a rate of 9, and an FiO2 of 0.5. The PEEP keeps the alveoli open at the end of a breath to ease the next breath and increase oxygen exchange.
Okay, Kat, do you remember me? I'm your nurse from earlier.
Yes.
Okay, so I set up a FaceTime call, a Zoom call with your family, and they're all waiting online for you, and they want to talk to you, and you can enjoy some family time,
They're
okay?
gonna think I look crazy.
No, they're not. This is for your best health,
They
okay?
know I'm gonna die.
You're not going to die.
Okay.
Talk to your family, okay?
Okay.
Let me know if you need anything.
Okay.
The patient has had a 2-hour Zoom call with the family and is now calm. Her demeanor has changed for the better.
Here's this back. I feel so much better now.
Oh, I'm so glad. I'm glad you feel better. Did your family help you calm down?
Yeah, I'm a lot less anxious. They told me I'm not gonna die.
Okay, good. And it looks like your oxygen has increased too, so that helped calm you down and you're less agitated and less restless, okay?
Okay.
You're doing really well. Hang in there.
Okay.
The patient is content with the treatment plan and is stable. Here are the COVID-19 NCLEX questions. Question 1. A client being weaned off a mechanical ventilator is placed on a BiPAP machine. Assessment reveals a respiratory rate of 33 breaths per minute, an O2 saturation of 88%, and use of accessory muscles. What action taken first by the nurse is appropriate? A. The nurse will have the UAP document findings. B. The nurse will continue to wean the patient. C. The nurse will prepare to extubate the patient. Or D. The nurse will prepare to reinnervate the patient and call the physician. The answer is D. The nurse will place the patient back on BiPAP and call the physician. The patient is not tolerating the wean and BiPAP still requires ventilatory support. Question 2. A common complication of COVID-19 is acute respiratory distress syndrome. Which treatment is likely to be implemented to treat this condition? Select all that apply. A. Mechanical ventilation. B. Place patient in prone positioning. C. Oxygen therapy. D. Administration of propranolol. The answer is A. Mechanical ventilation. B. Place the patient in prone positioning. And C. Oxygen therapy. Mechanical ventilation, prone position, and oxygen therapy are all interventions utilized with COVID-19 patients. Propranolol is contraindicated as this can cause bronchoconstriction. Question 3. The nurse should intervene if she observes a UAP walk into the room of a patient with COVID-19 wearing what personal protection equipment? A. An isolation gown. B. An N95 mask. C. A paper mask. D. A face shield. The answer is C. A paper mask. Isolation gowns, N95 respirators, and face shields are all required when interacting with COVID-19 patients. Just donning a paper mask is not recommended in the clinical environment. Question 4. When educating a patient on the drug remdesivir, what response made by the patient indicates that more teaching is needed? A. Remdesivir is an antiviral drug used to treat COVID-19. B. Remdesivir will be administered through an inhaler or nebulizer. C. Remdesivir will be administered to me for up to 10 days. Or D. My doctor may prescribe a corticosteroid for me to take along with remdesivir. The answer is B. Remdesivir will be administered through an inhaler or nebulizer. Remdesivir is an antiviral used in the treatment of COVID-19. It may be administered for up to 10 days. Patients often receive a corticosteroid along with remdesivir. Remdesivir is administered IV, not nebulizer or inhaler. Question 5. The patient's ABG results are as follows. A pH of 7.47, a bicarb of 24, a PCO2 of 30, a PaO2 of 75, and an SpO2 of 88%. What is the nurse's priority action? A. Place the patient on 2 liters of oxygen. B. Call a physician. C. Instruct the patient to breathe into a paper bag. Or D. Prepare for intubation. The answer is C. Instruct the patient to breathe into a paper bag.